Okay, so today we're going to talk about something really important, learning to listen to our own bodies. We're going to try and decode some of those super subtle signals of lung cancer. It's not just about what the signs are, but why they show up and what our bodies are actually trying to tell us. So let's dive right in. All right, let's kick things off with a pretty sobering fact, but it's a really crucial one. Lung cancer, it's the #1 cause of cancer deaths for both men and women in the US. And that right there, that's exactly why being able to spot the signs is just so important. So that kind of begs a question, right? If it's this common, why on earth is it so often caught late? Well, the answer is, weirdly enough, hiding right inside our own chests. And here's the real kicker, the heart of the problem. Our lungs, they barely have any nerve endings. What does that mean? It means a tumor can grow and grow, sometimes for a long time, without causing any pain at all. It's a silent process at first. And that's exactly why we have to get good at hearing the body's other signals, the much quieter one. Okay, so let's get into those first signals. And I want you to think of them less like a blaring fire alarm and more like whispers. They're these subtle little clues that are super easy to mistake for something totally harmless, like a common cold, or maybe just some allergies. And this is what makes these early clues so tricky, right? They seem so normal. You get a cough that just won't quit and you think, oh, it's just a cold. Your voice gets hoarse and you blame it on talking too much. You get a little short of breath and you figure you're just out of shape. It's so easy to explain them away. And then there are the more unusual ones, like nail clubbing, which is a very specific sign we're going to dig into right now. So what is nail clubbing? It's a really distinct physical sign. Basically, your fingertips start to get bigger. They kind of bulge, and the nails themselves curve downward, almost like the shape of an upside-down spoon. The nail itself might feel soft, maybe even like it's floating a bit. It's definitely not one of the most common signs, but when it shows up, it's a big deal.
Okay, so that's the whisper stage, but what happens if those whispers go unnoticed? Well, as the cancer gets bigger, the body starts to shout. Those quiet signals turn into loud, urgent alarms that are a whole lot harder to ignore.
Yeah, check this out. It really shows you how things can escalate. On one side, you've got those early whispers, but on the other, you've got the alarms. So that nagging cough we talked about, it can turn into actually coughing up blood. That mild chest discomfort can become a sharp, really intense pain. And that general feeling of just being off can turn into dropping weight without trying and feeling totally exhausted. See the difference? It's a huge shift. So, on top of those direct symptoms, lung cancer can do something else pretty interesting. It can cause these distinct collections of symptoms that we call syndromes. Think of them like specific patterns, another set of clues that can tell us a lot about where the tumor might be, or even what kind of stuff it's pumping out into the body. First on the list is something called Horner syndrome. This one happens when a tumor grows way up at the top of the lung and starts pressing on a nerve that goes to your face. And that pressure creates this really specific, one-sided set of symptoms. We're talking a drooping eyelid, a pupil in that eye that's smaller than the other one, and even less sweat, but only on that one side of the face. Pretty wild, right? Okay, next up is superior vena cava syndrome. Now, the easiest way to picture this is to think of a garden hose. Imagine someone steps on it. The water backs up, right? Well, that's kind of what happens here. A tumor presses on this huge vein, the superior vena cava, which is supposed to bring blood from your head and arms back to your heart. When that vein gets squeezed, the blood can't get through. It backs up, and that causes swelling in your face, your neck, your arms, and you might even get headaches from all that extra pressure. And last but not least, we have these things called paraneoplastic syndromes. Now, this is a really fascinating one. It's a whole group of issues where the cancer cells themselves start acting like little chemical factories, producing these hormone-like substances. And these substances can cause all sorts of chaos in other parts of the body. So this isn't about a tumor pressing on something, it's about the chemicals it's releasing, leading to things like blood clots or weird nervous system problems, far away from the lungs themselves. All right, now we're going to shift gears a bit and talk about what happens if the cancer spreads or metastasizes. When lung cancer travels to other parts of the body, it starts to cause new symptoms that are specific to wherever it's landed. So for example, if it spreads to your bones, it can make them weaker. This usually shows up as a deep, persistent pain, especially in big areas like your back or your hips. And sadly, it can also mean that bones might fracture from a minor fall or injury that normally wouldn't cause a break.
And if it moves into the nervous system, the brain or spinal cord, then the symptoms are going to be neurological. We're talking things like headaches, feeling dizzy, or having trouble with your balance. It can also cause numbness or weakness in your arms or legs, and in some situations, even seizures.
And what about the liver? Well, if the cancer spreads there, it starts messing with all the important jobs the liver does. The most obvious sign is often jaundice. That's when your skin and the whites of your eyes start to turn yellow. And that can also come with pain in your abdomen.
Okay, so we've gone through a lot of information, and I want to be really clear. The point of all this is not to make you worry, it's to empower you. Knowledge is the first step for sure, but the next, and honestly the most important step, is knowing when it's time to actually do something with that knowledge.
So let's cut right to the chase. Out of everything we've talked about, what are the absolute red flags? The ones that are non-negotiable. Go see a doctor right now signs.
Here you go. This is the critical checklist. Number 1, a cough that isn't just sticking around, it's actively getting worse. 2, chest pain that gets sharper when you take a deep breath, cough, or even laugh. 3, coughing up blood, ever. And 4, you keep getting lung infections, like bronchitis or pneumonia, one after the other. Any of these demand a visit to your doctor, no question.
And this right here, this is why we're talking about all this. It's not about fear, it's about opportunity. Because knowing the symptoms gives you the chance for an early diagnosis. And an early diagnosis means you can start treatment sooner and ultimately have a better quality of life. That's the whole point.
So I'll just leave you with this final thought. A lot of us wait for those big, loud, can't ignore them alarm bells before we pay attention to our health. But maybe the real power is in learning to hear the whispers, those subtle little changes and patterns. Because at the end of the day, nobody knows your body better than you do. So the question is, could you be a better detective of your own health?